COVID-19 may no longer dominate headlines the way it once did, but recent spikes in neighboring countries like Thailand serve as a timely reminder that the virus is still very much around. With Malaysia preparing to host large-scale events such as Lima 25 and the ASEAN Summit, it's important to revisit what precautions the public should still be taking. To help us better understand the current situation and how we can all stay protected, joining us now is Dr. SAZALI BASRI, clinical specialist from the Infectious Disease Unit, Department of Medicine, Universiti Malaya Medical Center, UMMC. Welcome, Doctor. Thank you for doing this. Now, we've seen a sharp rise in COVID-19 cases in neighboring countries like Thailand, and while Malaysia is hosting major events such as the Lima that's ongoing right now and also the ASEAN Summit this week, from a medical perspective, how serious is the risk of cross-border transmission?
Okay, so as you are aware, so our neighboring countries, for example, Thailand, Singapore, and even Hong Kong had reported the spike of COVID-19 cases recently. But I believe from recent statement by Ministry of Health, the case is still stable in Malaysia, and we didn't see the rising of cases above the threshold that we should worry. So I think with the reporting case that increasing around our neighboring countries, the Ministry of Health being ready and increasing our surveillance to detect early warning sign or increasing case that we should worry, especially when major events such as Lima and also Asian Summit will be it will be soon in Malaysia.
Right. In light of regional case increases and the potential for cross-border transmission, should Malaysia consider reintroducing stricter screening measures or mandatory testing or even proof of vaccination for international arrivals like we used to do before?
I think we believe, we've been living with COVID-19 since many years already, 5 years, and backing backward with restricting the borders, I think it's not a good idea. And with early detections, precautions in which self-care I think everyone's now aware about prevention measures, for example, good hand hygiene, health etiquette, wearing masks, or if, for example, you are a vulnerable populations, having medical conditions or advanced age that higher risk of getting severe COVID-19. We know how to avoid such crowded areas and reduce our risk of getting COVID-19. And at the same time, the case reported in neighboring countries also could be due to waning off dominance of COVID-19 immune protection. So by updating our booster vaccines for COVID-19 is something that we should reconsider again. So I believe COVID-19 vaccinations, the updated one, have been available in Ministry of Health, Klinik Kesihatan, and we can just easily access it through MySejahtera. Yeah.
Right. So many people now treat COVID-19 symptoms like those of the common flu. From your clinical experience, how can individuals tell when it might be more than just a seasonal illness? Are we still encouraging people to do self-tests at home?
Yes, it is very difficult to differentiate between common flu and COVID-19 because the presentation is similar with respiratory symptoms of cough, some fever, muscle pains, and it's just very similar. But I would encourage people for early testing because early testing, it will prevent the further spread of the disease, and at the same time, by early detections, it also enables us to get early treatment. For example, if you are someone who at higher risk of getting a severe disease, we may get antiviral, for example, Paxlovid, to reduce the risk of progression of the disease into severe diseases. Yeah.
Right. Vaccination is not as widely discussed anymore, but do you think it still plays a role in protecting high-risk individuals, especially those who are attending crowded events or, perhaps those who are even planning to travel? Now, most of us have already gotten our first and second doses. Booster jabs are optional. Should we be taking our booster jabs regularly, perhaps annually or so?
Okay, so I think in Malaysia, we're not emphasizing booster vaccination yet, but a lot of countries have started implement a compulsory booster yearly for COVID-19 for high-risk population, especially elderly or those with medical conditions, for example, cancer or healthcare professionals or even people who live together with people at higher risk of getting severe disease. And I think recently, for those who planning to go for Hajj, Saudi's government had made the updated COVID-19 vaccine compulsory, although it's been withdrawn back recently. But I think it's an option for us to protect ourselves and to reduce the risk of severe disease. Although the evidence for those young people without medical conditions for booster vaccination is not that strong, but I think it's up to us because COVID-19 infection is not can lead severe disease, but it's also can lead to other complications. For example, long COVID syndromes, in which it may do affect our quality of life and also daily living activity.
Right. So the recommendation is, even though COVID is no longer a severe health risk, or it doesn't pose, death risks as it used to be, that we should still keep vigilant and, if we can, whenever we can, try to update our vaccinations. Doctor, now as we continue living with COVID-19, what are some good habits that the public should maintain, particularly when attending large events or, traveling through busy spaces? Because when we were living with COVID-19, we still are right now. However, I think some habits we've tend to forget. It used to be, hand washing or using hand sanitizers. What are some of these things that we should continue to practice?
I mean, with this recent development and recent news, it just clearly states that the pandemic is not over yet. So it continues to pose a significant threat to our public health system and especially the importance of preventive measures to reduce the spread of COVID-19. Yes, self-care, hand hygiene, cough ethics, wearing masks, and also avoid crowded spaces or confined spaces is important. But we also need to aware about protecting ourselves by updating booster vaccination for those at higher risk of severe disease. At the same time, I believe government had start to increase vigilance in their surveillance by re-establishing a close data sharing with our neighboring countries and also strengthening our public health communications to ensure communications and so misinformation being spread that avoid unnecessary panics among the public. Yeah.
Doctor, do you think the public has gotten slightly complacent when it comes to COVID-19? That it's not as big as a worry as it used to be before?
I mean, yes, I think because of the threat is a bit. It's reducing now. We didn't see as much of that as before, but this self-care vaccination is for most of the infectious disease, including healthful mouth disease that be increasing in our country. So by self-care, good hand hygiene, cough ethics, and other prevention measures, it able to reduce the risk of most infectious diseases, including healthful mouth disease, COVID-19, and other disease that can easily be prevented with such good care.
Right. Last one, Doctor. Now, although the national case numbers have remained relatively stable, there has been a very slight uptick recently. Please tell us why it is still important for the public to stay alert and not assume that the pandemic is completely behind us.
Yes, I mean we've been living with this COVID-19, and this threat is continuously pose significant health and also economic threat to our countries, and by being vigilant, we able to protect ourselves and also protecting people around us. So kita jaga kita. So it's important to be vigilant. The importance of self-care and also and other public health measures to reduce the risk.
All right, that's all the time we have for now. Thank you so much, Dr. SAZALI, for those valuable insights. And while Malaysia's case numbers remain stable, for now, vigilance is still key. Always remember that protecting ourselves means protecting those around us, especially the vulnerable. Now, I'm going off for a very quick break. This is The World on Bernama TV. We'll be right back.